mean, there are many molecules and older drugs that have been tested as either prophylaxis or as treatment. We'll have to get back to you on whether or not there are any ongoing trials using ivermectin. We'll probably get back to you before the end of the press conference. We just need to check that we give you the right information.
Okay, Lara, stay in touch. We will provide that. We will now hear from Raid Wilson from The Hill. Raid.
Sorry about that. Can you comment on the rising number of cases in the United States, particularly in southern states? What do you make of the rise in both positivity rates and cases among younger people?
Yeah, I think there's been upticks in cases in a number of states in the US. I'm not 100% sure about the age profile, but I've seen the reports that some of this is amongst younger people. That may reflect the fact that younger people are more mobile and are getting out and taking advantage of the reduction in the restrictions of movement. And this is something that WHO has spoken about many times. Many countries have experienced clusters of disease or upticks in the aftermath of reducing stay-at-home orders or allowing population mobility to happen. What we've said, and I believe the scientists in the US are saying this over and over, is that maintaining vigilance around physical distance, personal hygiene, the wearing of masks according to the national guidelines and where appropriate, the increase of surveillance so that clusters are investigated, testing, tracking, isolating cases, quarantining contacts. This is what needs to continue. And I believe that is happening in many countries and in many states in the United States. So I think it's for at the federal level, I'm sure our colleagues there are looking at this and what the implications of this are, state by state. Each state is unique, and I'm sure each state is looking at the implications of this for their population. What is clear is that the increase is not entirely explained through just increased testing. There's some evidence of increasing hospitalizations, but this was always a possibility when restrictions are lifted, and again has happened in many countries. The issue is not the rising numbers per se. The issue is what is to be done to bring those numbers back, and what combination of measures can be used in order to do that in terms of targeted public health measures, increasing surveillance, increasing cluster investigation, and ensuring that we identify cases and contacts as quickly as possible, isolate the cases, quarantine the contacts, and where necessary, and hopefully at a much more localized level, there may be a need to put some restrictions in place in order to suppress infection. And again, we've seen countries do that at a micro level, not at a state level or even at a national level, but to where needed, if there are clusters of cases with potential for community transmission, that there may need to be some adapted measures to suppress infection while the clusters are investigated. Yeah.
We will now go to Carlo